Okay, well, good evening, everybody. Thanks so much for joining us. And I hope that everyone has had a wonderful, wonderful day. I'm Michelle Moser. I'm with Makers Compounding Pharmacy. And tonight we're going to talk about some of the root causes behind autoimmune issues and some of the treatments that we have found to be helpful. If you have any questions, please let us know how we can help you by dropping your questions into the chat. And I will be checking on those occasionally. And Scarlett, who is with us as well, will be making sure that those questions get answered too. But if at any time you have questions, please, please, please feel free. So it looks like we have people joining us from literally all over the United States, both as practitioners and as patients. So I thank you again for taking your time out of your busy evening to join us. All right, well, let's get started. So currently there are absolutely more than 40 specific autoimmune diseases. There's really more than 100. And a lot of times, rarely are people diagnosed with just one autoimmune issue. And the reason is because there's a lot of inflammation, and usually this isn't a new disease that has come on. It just takes time for things to build up, for sequelae to show. And quite honestly, what we also see is that many times providers are, or patients are actually going to many providers just trying to get to the bottom of what's going on. They have a variety of symptoms. Some of them seem to be fairly generalized, but the bottom line is that they're suffering and they're just not getting the answers that they really want. What we do know is that there are some very specific things that can relate to autoimmune diseases, and we're going to go over issues about what's going on in the gut, how to use low-dose naltrexone, but also how dietary factors can play a risk or play a part as well. And I'm trying to, for whatever reason, Scarlett, I cannot read the chat, so I will let you do that as it comes up.
That's okay. Someone said hi from Australia, so I said thank you for joining us.
That must be Toby. Hello, dear. She is a volunteer with the LDN Research Trust as well, just as I am. So thank you. It's very nice to finally put a face on things. We're going to talk a lot about low-dose naltrexone, and I don't have it in my slides, but I will also be talking about some of the newer information that's available in the LDN book, volume 3, which just came out a couple weeks ago. So as you can see, there is a wide variety of issues related to autoimmune diseases. Some of them will manifest in the thyroid, perhaps in the bone, in the muscle, even in the skin. We even see it in the lung tissue as well as the nerves, creating a wide variety of neuropathies in the brain, in the blood, and even in the GI tract. And just because you have one doesn't mean that it's going to stay there forever. Sometimes it does. Those antibodies can transverse, but really what's happening is that because of the inflammation that's caused by so many of these other issues, we tend to then have symptoms show up elsewhere just because of the inflammatory processes, but really the degradation of the other tissues leading to the transition or the transversing of other issues, and therefore new diagnoses. But what's also very important is that we also want to pay attention to what really happens here as well, because emotional wellness is just as important as physical wellness. And what we do know is that sometimes medications that we use to help with physical symptoms can actually play a different role in our brain and how we not only manifest some of those symptoms or some of those side effects, but even what the medications do to our gut, and then how things can change as well. So this is a little heady, but I wanted to give some very specific reference material as well as to what actually happens with autoimmune issues. And this is very specific, and I do give the 2 different citations with this. But basically, inflammation is also a cause of autoimmune diseases such as rheumatoid arthritis, in which excess levels of very specific cytokines such as tissue necrosing factor alpha, interleukin 6, interleukin 1b, and interleukin 8 are often found. Multiple sclerosis, another AI, is caused by chronic inflammation in the central nervous system, activated by tissue necrosing factor TNF alpha. B is found in patients with MS, as well as elevated levels of other cytokines, which have also found in frozen sections of the CNS tissue from other patients, and that's usually found on autopsy. Similarly, cerebrospinal fluid samples from patients with Alzheimer's disease, Parkinson's, ALS, MS, and schizophrenia have also shown to exhibit an overexpression of these cytokines as well. And in these patients, even with diabetes, high levels of C-reactive protein, interleukin 6, interleukin 1, and TNF alpha, along with abnormal expression of necrosing factor beta, is also observed. And what's really important here is that no matter what we're talking about inflammation. So it doesn't matter which organ the inflammation goes after, we're talking about inflammation. And that really is, unfortunately, the key factor to, or the similar symptom across all issues. What we also know is that many, many times there's also a vitamin D deficiency. There's perhaps even a viral infection, such as Epstein-Barr or even Lyme. And those can be infections that have been around for years and years and years in an individual before they're actually finally diagnosed. And that's primarily because those symptoms associated with Epstein-Barr or Lyme or Stevens-Johnson syndrome, a wide variety of other issues, tend to be really generalized and vague, and therefore attached to other diagnoses that seem to be maybe even easier to treat. But there's also a very, very broad lack of testing, and mainly because when you test for Lyme, you have to be very, very specific. And when we're looking for those very specific markers associated with Epstein-Barr or other viral infections, we need to look specifically for them. And depending on where someone's at in that disease state, we could potentially have different results. So it can be a little bit tricky. Smoking is absolutely a key factor, and a wide variety of hormonal imbalances, not just the sex steroid hormones, but we will talk about menopause and how that has an effect, but also those hormones such as melatonin, thyroid, insulin, and really vitamin D is a hormone as well. But we also have to take a look at nutrient deficiencies. And sometimes these nutrient deficiencies are not necessarily a dietary restriction or a dietary change, but really the medications that someone is on is causing those nutrients to leave the body or not even be absorbed by the body. And that's just as important. We need to be very, very careful with those. So all of this has a very significant impact on autoimmune diseases and also their progression. Women tend to have more autoimmune diagnoses than men do. And this is a citation specifically to this PubMed online research article that was found. And if you look, this was actually published just about 3.5 years ago. So it's unfortunate. It's not sexist. It's just a thing. There are a wide variety of triggers for autoimmune diseases. Many happen associated with diet. That can also affect what's actually happening in the gut. Anytime there's an issue with stress, we know that a lot of people with fibromyalgia or MS tend to have more flares, or even viral infection. They tend to have more flares when they're under stress. If there's a hormone imbalance, we can see a wide variety of flares. Exposures to pathogens, whether those are environmental toxins or even some of those other infections, specifically protozoa, virus, etc. Anytime there's a lack of sleep, that will definitely change the circadian rhythm. That will actually change our restorative sleep patterns as well. And of course, medications. And all of this comes down to what is actually going on in your gut. And I really just can't stress that any more than what I do. But quite honestly, gut dysbiosis is the number one area where we can all change what is going on and have a positive impact, even if somebody's been diagnosed with an autoimmune disease. But really, how to minimize the symptoms really starts in the gut. The root of most diseases is with inflammation. It doesn't matter if it's an allergic response to something. We all know if you have seasonal allergies such as hay fever, you get really stuffy and you feel very full. And again, that's an allergic response. It's the body's innate reaction to going after those invaders and trying to gather them up and wash them out so that they go away and they don't cause any more harm. But we can also relate those to very specific eye disorders. Asthma, diabetes is absolutely inflammatory. If your blood sugar level is high, if it's over 100 at any given time of the day for any length of time, and I'm not talking about just the 2-hour postprandial, but just a chronic inflammation or a chronic elevated blood glucose level, you're going to have some more issues. That can also relate back to what's happening with cancers as well as arthritis and joint pain. And a lot of times we're looking at a factor of obesity, which is inflammation. Psoriasis can be caused by either a fungal infection. It can then give rise to psoriatic arthritis as well, as that fungus moves from the gut and actually deposits in the joints. And that is a very painful issue. It can then also manifest on the skin. But again, all inflammatory. Same thing with infection and injury. Genetics versus epigenetics versus environmental. We're born with a set of genes. Okay, so we can't change that, but we can change the way those genes are expressed. And a lot of times these autoimmune diseases are really an expression of what we were given when we were born, but sometimes there are some small changes or interchanges that are then going to allude to a wide variety of symptoms. Sometimes nutrient factors play a role, hormone balance plays a role, and certainly a wide variety of other inflammatory risk factors as well. So just because you were born with a set of genes doesn't mean they have to be turned on. There are some that are fairly selective and don't have to manifest to then cause other disease. Sometimes, though, we're just kind of prone. And as a female, that happens even more. There is a way to take a look at what you are predisposed to. There's a wonderful genetics test. It's called 3x4 genetics. It's a quick cheek swab. It looks at 36 core insights, and it determines a wide variety of inflammatory markers, what's going on with organ health, whether your hormones are balanced. How is your brain? Is it healthy? Is it inflamed? What's going on with nutrient status? A wide variety of metabolic pathways. Even goes down to what kind of exercise should you be looking to incorporate into your daily routine. Are you predisposed genetically to being a distance runner or someone who needs to do more passive type of exercise such as yoga? That might be a better way to go that. Toni Marthaler is a nurse practitioner who I think very highly of. She's just one of those most amazing integrative functional medicine people out there. Absolutely. Not only do I feel very honored to call her my friend, but also I just love the time when we can get together and geek out on the phone or otherwise. And she is a 3x4 genetics consultant as well. and I can provide you with her information if you wish. But 3x4 Genetics, in my professional opinion, is one of the best genetic testing out there. So you know what you have, and then you can move forward. You can make choices for yourself, because that's the bottom line. We're here to learn so that we can be empowered and then move forward with what's going to be best for us. Now, there's a very, very strong correlation as to what's going on with our gut versus what's going on with our brain. Case in point, Thanksgiving's coming up here in a couple of weeks. Happy Thanksgiving, everyone. And when we sit down and we have a traditionally turkey dinner with all the carbohydrates, right? The stuffing, mashed potatoes, maybe sweet potatoes or candied yams. Usually there's, cranberry sauce, which has a lot of sugar in it, things like that. And one of the first things that we do is we want to take a nap afterwards. But you also know that sometimes if you have sensitivities to certain foods, you eat those and they cause other reactions in your body. If you have a mild intolerance or even an allergy to something and you eat it, you might get a burning in your gut. You may have a quick dumping. You may have even days later where you just don't feel all there. Some people get really grumpy. So I know of a few people who have a wide variety of allergies, and some of which are very difficult to pinpoint. One individual that I'm thinking of is very allergic to nuts. Well, as that person has aged, there are other kind of related chemicals that have come up that are also related to nuts. One of the chemicals is called annatto, ANNATTO. And it's a yellow coloring that's in like popcorn. And when you go to the movies, it's in that yellow coloring that they use in that artificial butter. But it's also used in like pasta sauces, as well as colorants in foods and other additives. And it's actually derived from corn. But what's interesting is that it is related somehow to nuts. And in doing that, it can cause sensitivities to those people who eat nuts. And this individual literally reported that went to dinner. I think it was an Asian dinner, and then went to the movies and had movie popcorn, got home that night, and within 2 hours, literally was covered in hives head to toe, scratching palms, scratching every inch of their body. Literally took a couple of EpiPens and lots of Benadryl and some H2 antagonists like famotidine. Well, we used to have Zantac, ranitidine, but now we only have famotidine. And it literally was, that individual was super close to going to the ER because of all of the inflammatory issues. So it can mess up your brain too. And that person was grumpy for weeks. So I kind of look at it is that the connection to the brain is very much tied to the gut, primarily also because about 90% of our serotonin that makes us happy is made in our gut. Food sources for our brain, medium chain fatty acids, are made in our gut. And about 70 to 80% of our immune product or systems to actually support the immune system are made in our gut. So if we have a leaky gut, if we have disruption in the single cell layer that lines the entire gut, if we have inflammation there, or it's leaky, if somebody's been diagnosed with IBS or IBD or leaky gut or SIBO, which is a fungal overgrowth, any of those things, even just normal metabolites can leak out of the gut and land in the skin, but also be transferred to other areas of the body and even the brain, and they can cross the blood-brain barrier and cause a wide variety of inflammatory processes. So we need to be super careful. We also know that gluten can sometimes substitute for the thyroid molecule because it looks very, very similar. So if somebody has an autoimmune disease associated with their thyroid, we need to be very careful, and they really ought to be not just a little bit gluten-free, but 100% gluten-free. And we also know that a wide variety of other autoimmune diseases are also very susceptible to gluten, where just having gluten in the diet, and gluten is hidden in very crazy places, can lead to a progression of that autoimmune disease, primarily because of the inflammatory processes that are a result of eating gluten or casein, which is those peptides or those proteins from dairy products. So whether we're looking at an irritable bowel disease, a leaky gut, sometimes even insomnia, depression, hormone imbalance, we really need to test. And I think one of the best gut tests out there is BiomeFX. It is a gut test, it's a stool test that is provided by Microbiome Labs. It is about $400 to run the test, but it gives you a complete DNA sequencing of everything that's growing in the gut. What that can also help you to understand is what's missing, what needs to be replaced, or what is growing there. And did it derive from your mouth? So in other words, have the oral biome actually leaked into the stomach area? And that's really important because sometimes that can then lead to cardiovascular risks. That can also lead to pathogens that normally sit in the mouth that are now transverse to the gut. That can then lead to even pancreatic cancer. So there's a lot of research out there that shows all of these progressive issues. And in the meantime, we can make changes to ensure that we're well hydrated, that we're eating the right foods, because those foods go into our stomach. The bacterium, the fungus, everything that's there then breaks all the foods down, breaks all your liquids down to then hopefully liberate the right nutrients that should be absorbed down the pike. So the small intestine, and then water removed from the large intestine to be put back into the body. Now, those byproducts, those metabolites, are supposed to also then help support other inflammatory processes to reduce those, to also help keep our weight under control, to help us to also regulate those chemicals in our brain that help us to function. Now, if we don't have the right mix of the good guys, and we have maybe too many of the bad guys, we have a wide variety of symptoms, maybe belching, maybe distended belly. It could be even food cravings that can cause a wide variety of issues. But if you're low in the metabolic byproducts that are supposed to be there, GABA, butyrate, propionate, maybe your ammonia is too high, we can literally look at the bacterium and all of those microbes that are in the gut, and we can literally say, maybe you shouldn't be eating raw vegetables, maybe they should be slightly cooked. Maybe we need to treat and get rid of some of these bad guys and repopulate with the good guys. Or perhaps you need a variety of supplements to boost or raise the level of GABA so that you can actually feel happier. So there's a wide variety of issues that can be addressed. But what we do know is that a lot of those microbes can then lead to changes in our thyroid, changes in other organs as well, and can then also be associated with autoimmune diseases. The BiomeFX test is about a 20-page report. It's in full color. What I also really, really enjoy about this test is that as a practitioner, if I get a test result back and I'm not quite sure about things, I can actually schedule an appointment with one of the consultants from BiomeFX, and we will walk through this test specifically. It's wonderful. It really helps to understand the association between what's there, what's not there. So for example, If you're low in Akkermansia, you probably are having issues regulating your blood sugar, because we know that that one microbe, Akkermansia, helps us to regulate blood glucose. We also know that's how metformin works. So perhaps those individuals that are having issues regulating their blood glucose and therefore have issues with weight, issues with pain and inflammation, perhaps either autoimmune issues as well, they don't have enough Akkermansia. So maybe we need to put some of that back. We can put that back, but we can also then change the foods that are put into our bodies to then change Akkermansia as well. So the reason why I bring that one up is because we have seen over and over and over again that this is a direct correlation to what's actually happening with diabetes, hemoglobin A1C, and just a wide variety of better control. Because we know specifically if we're able to control blood glucose levels so much better than what we currently are, we have better health throughout life, perhaps less dementia, perhaps less Alzheimer's, etc. Because nobody wants to be 70, 80 years old, dragging around a suitcase full of medications and not being able to do the things that are on our bucket list. I mean, that's why we work for as long as we do, to help put a little bit of money aside so we can do the fun things that we really want to do. So, but we need to be in good health to be able to really share in all of those areas. Very common autoimmune disease, Hashimoto thyroiditis. I should actually change the name of this slide and not only call it Hashimoto, but maybe / Graves' disease. So Hashimoto is usually associated with a low functioning thyroid, Graves' disease, usually a hyper functioning thyroid. But quite honestly, I have yet to meet anybody who's one side or the other. They usually have this roller coaster of symptoms. And a lot of times they're treated with a lot of different medications, and sometimes they work and sometimes they don't. But what we have found is that with using very specific compounded medications such as LDN, we can actually not only help control the antibodies that are attacking the thyroid gland, but also improve overall life and quality of life and reduce a wide variety of other symptoms so that we can have better control and then also help to minimize any other risk factors further down the line. So about 30% of Americans are affected by chronic pain, and usually chronic pain is associated with a wide variety of autoimmune disease, whether, again, it's Hashimoto or it's a osteoarthritis or a psoriatic arthritis or PMR, polymyalgia rheumatica. It could be a wide variety of issues. Perhaps it's a chronic pain that is associated with an injury, such as chronic regional pain syndrome. Now, that's a chronic injury, not necessarily associated with an autoimmune disease. But what we also see is that when someone is chronically in pain, their gut biome can change as well, a lot of times because of the medications that they are prescribed. We also see Crohn's disease, which is a digestive tract disorder. Crohn's disease is unfortunately an issue that can plague someone's life and cause a wide variety of other issues as well, as even oral health changes, rapid aging. It can cause muscle to degenerate as well. But what we do find is that, again, using low dose naltrexone is very helpful. And when I'm showing a wide variety of these articles, if you would like a copy of them, please let me know. This specific article was authored by Dr. Jill Smith, and she is currently looking at patenting low-dose naltrexone for Crohn's disease. She is in the drug trials and associating this with that. And I think it's going to be very interesting to see what happens with that. LDN can also help with a wide variety of inflammatory processes. You saw this slide earlier. But not only do we need to balance the gut, but we also need to take a look at hormone balance. And the reason is because in the gut, there are estrogen receptors. In the brain, there are estrogen receptors. There's estrogen receptors everywhere, but it's not just about estrogen. We also need to take a look at testosterone, progesterone, DHEA, and we can't forget cortisol, as well as even insulin and other readings as well. Testing is always the best way to find out exactly where you're at, so that things can either be replaced if you're very low, to ensure that you stay within physiologic balance and that we're not increasing inflammatory responses by having too much hormone. But if there is an area of hormone that is a little in the excess area, then we can actually use herbal medications or other pathways to reduce those. So again, that we find a good equilibrium, we find a really good balance. We can test hormones in saliva, in serum, and also in urine. And it is key to understand when to use those tests and when not to use those tests, because they're not the same. Serum tends to be the gold standard, although I don't think it's very accurate, because hormones are oily substances and our serum is water-based. And so the oils are not meant to stay in the water medium. So we produce carrier proteins called sex hormone binding globulin to then pick up those hormones and whisk them away to the target tissues. Whereas when we look at saliva, it's more of a passive migration of hormone and more of a representation of how much hormone is in the cells in those tissues. Urine allows us to take a look at what happened to those hormones. So we had a hormone in our body, whether we're replacing it or it's naturally being produced, and then how is it being metabolized through our body? That's also very key, because some of those metabolic pathways are not so great for us and can actually lead to even more inflammation and perhaps even cancer. So when we test and we have that information, that's great knowledge so that we can learn to balance those hormones. And then we're also not necessarily taking a 70-year-old woman and rebalancing her back down into her 20s. I don't think that that's physiologic. I don't think that's the best way to go about doing things. But that is how we can also take a look at better aging, better weight control, and just overall better health. Now, we know that menopause is a transition situation, but what we've also learned, and this study was from 2007, 2006, and it's a Japanese study. A lot of the really great research that I've read, specifically around hormones and LDN and autoimmune issues, a lot of them are coming out of Asian countries. And I just find that very fascinating. But specifically, they were able to simultaneously measure a wide variety of cytokines, which cause inflammation in the body, and take a look at the concentrations of those during a menopausal transition. And they changed. What they also found is that interleukin-6, so interleukin-6 has been much more widely talked about in the last 2.5 years, because we know that it is the primary cytokine or the primary pro-inflammatory chemical that surrounds even lung tissue when the COVID virus would deposit in the lung tissue, and the interleukin-6 would go in and cause all the inflammation. But what we have also seen is that IL-6 increases during menopause as estrogen goes down. Interesting. We can also see that a general immune response tends to decline as menopause progresses. And again, that's usually due to relatively low levels of estrogen. We know that estrogen and progesterone do have a role with the immune system, as does testosterone. And so again, clearly, it's very important to ensure that as we go through menopause, it's not just about night sweats and hot flashes, but also how she is feeling. How is her gut feeling? Making sure that we can keep everything else under control. That also goes right back to ensuring that the gut biome is well cared for, and that we're providing a good environment to ensure that hormones, when they are ready to leave the body, they can leave the body. The majority of hormone is actually eliminated in our fecal material. But if our gut is not healthy, a lot of times it can be reabsorbed. And then we go into a wide variety of imbalance processes. We also see that even starting as early as perimenopause, which is a very interesting term because perimenopause could be in their 20s. It's not necessarily a 5-year window anymore. It's really a much earlier window, but that perimenopause can be a pro-inflammatory issue because a lot of times estrogen is not regulated. So recently, we've been doing a wide variety of saliva tests based on some requests from a lot of providers in the Skagit Valley on younger women who are finding they're having difficulty getting pregnant. Some of them have been on oral birth control, synthetic estrogen and progestin. Some of them have not, but they're finding that they have some infertility issues. But we're finding that women, even in their 20s, have very low salivary estrogen levels, and their progesterone's even lower. And we're really kind of curious as to what's going on. So again, if we're not balanced, we're not going to have good immune systems, and we're not going to be able to then carry on with basic functions such as reproduction. So we want to make sure that everything is in balance, not too much, not too little, because when we get into the cellular function, how the mitochondria functions, it's really about those receptors on the outside of those cells that can either cause that cell to be inflamed or nutrients perhaps not being able to transverse into that cell so that that mitochondria can function appropriately. So we've also seen the role of progesterone on a wide variety of androgens, leptin, oxytocin, another wonderful, very calming hormone, prolactin, and the interplay between the two sides of the immune system. So the Th1 and the Th2 going from inflammatory to less inflammatory or allergic to balanced. There's a very delicate change in that. And when we want to move from an allergic or inflamed area to a less area, we can see better tolerance and and better control of autoimmune responses, and therefore decrease side effects when we can actually modulate from a Th1 to a Th2 side of the immune response. LDN also helps us with that. So when we're looking at a perimenopausal woman, which is very interesting because a lot of people who are diagnosed with multiple sclerosis tend to be women around the age of 35 to 40. Again, perimenopausal years, very interesting times. But it's not just about women. Men have issues too. Men's hormones tend to decline as well. And that's happening earlier and earlier. And we could definitely see changes happening earlier in younger men. Some of the symptoms that happens is a change in body structure, but also hair structure as well. Some people actually start losing their hair much earlier. And we can see that by changing the way hormones are metabolized and balancing that, we can see better control even of cholesterol and other inflammatory chemicals that cause the cholesterol to stick to those vessels in the body. So when we decrease testosterone, we see an increase in pro-inflammatory cytokines. When testosterone is low, we also see a higher risk of cardiovascular events. When testosterone is low, we also see changes in increased weight and a change in thyroid function, and also a change in digestive issues as well. And of course, men are usually looking at their PSA numbers and looking at prostate health, just as women are taking a look at their hormone structure and very much looking at breast tissue changes as well as uterine changes. Dr. Erica Schwartz is been very busy in taking a look at how the cardiovascular disease presentation happens in men and women. And she will be speaking at the A4M conference in Las Vegas, December 8th through 11, I believe it is, when they have their international summit. So that'll be really nice to hear that as well. And again, if you'd like these citations, please let me know. So I've touched on low-dose naltrexone a little bit here and there. So let's talk a little bit more about that, getting into more of a deeper dive. So specifically, low-dose naltrexone is a medication that was FDA approved back in 1964, but it really wasn't until the 80s that we found more about its activity at very small doses versus its very typical doses. And what we find is that when we use low-dose naltrexone or naltrexone in very small doses, perhaps 0.1 to 4.5 or 6 milligrams, we see a variety of changes in its effect and its condition on the body. Whereas when we're seeing, or when we're using medications, naltrexone in higher doses, for example, 50 to 300 milligrams, we're using that for very different diagnoses, such as alcohol overuse syndrome or methadone withdrawal. In higher doses, naltrexone does change liver function tests in most individuals, but when we are using naltrexone in very small doses, we do not see that activity in the liver. We also see that low dose naltrexone tends to decrease inflammation by decreasing the cytokines that are being produced. We see that it will modulate the immune system. And specifically with that, we're seeing that certain doses can actually suppress the immune response, whereas if we bump the doses up, we can actually see, or lower the doses, we can see even a different change in the immune response. So literally, what we see at a dose of 1 or 1.5 milligrams is often different than what we see at 4.5 and 6 milligrams. So when providers say, well, I'm just going to jump right in at 4.5 milligrams, it's like, oh, please don't do that. We need to start much lower and slowly increase the dose so that we can find that individual's happy dose. Because if you jump in at 4.5, most people are not going to respond well. I mean, literally, maybe 15, 20% of people will respond. So you're going to have a very low success rate. As a compounding pharmacist, I love to allow my providers to be the heroes in all of this, quite honestly, because when they can suggest a therapy that is going to help someone who's been suffering for decades and perhaps has seen several doctors, maybe even tens of doctors, but has been suffering for so long and has had a wide variety of changes in their lifestyle, their ability to move, their ability to think, even integration with relationships. But when there's been a profound effect on someone's life for that long period of time, sometimes we need to set the expectation that 4 to 6 months from now, perhaps low-dose naltrexone will be the best thing that you've ever found. We don't know, but we got to give it some time. So let's start low, slowly increase the dose over time. We might even go through 9 or 12 dosing changes within a 3-month period of time. That's okay. And we have dosage forms to allow for that to happen. But in doing so, we can modulate the immune system. We can intermittently block those pain receptors. We can reduce inflammation throughout the entire body, and perhaps even see lessening of the laundry list of symptoms that patient already has. And we can do this with a low-dose medication that comes with low risk, low side effects, and relatively low expense as well. This is one of my most favorite studies, and it's literally not really a study. It's a compilation of about the first 900 articles, and literally the first 900 articles written up to, I believe it was 2018. So this was compiled by a wide variety of providers at the University of Dartmouth, and they summarized the information of 900 articles and case studies based on disease state. So they have disease state, they have all of the articles, what the scientific method was, the dosing range, the summary of the article, and the conclusion. And I find that very, very helpful. This is one of my favorite things to hand out to providers, primarily because it summarizes very quickly. So people can look at the science, and if they're looking for something on Crohn's disease, it's all right here. But if that individual also has fibromyalgia, well, then let's go look here. And so the science is there. And quite honestly, I've been a pharmacist for 35 years. I have yet to find another medication that's been studied so thoroughly, but yet is not commercially available. Strange, but true. What we've also seen is that these studies can improve the quality of life, not necessarily just looking at symptom control, but anytime you control symptoms, you're going to have better quality of life. The editor of the LDN book, volume 1, 2, and 3, is a multiple sclerosis patient herself, and her story is in each one of the books. And I can't thank Linda Elsegood enough for all of what she has sacrificed and put into bringing low-dose naltrexone to the forefront of a wide variety of conversation so that so many people can use this medication and feel better, not just if they have MS, but if they have autism, a wide variety of other autoimmune diseases, PMR, Crohn's disease, fibromyalgia, Hashimoto, thyroiditis, Graves' disease, which is combined. Even taking a look at low-dose naltrexone with cancer. So many different areas. And to have so much research out there. And the research that I show you here is from 2010 and also 2016. But there's more. But the bottom line is that low-dose naltrexone doesn't cure a thing. It actually tricks the body into working on its natural mechanisms and behave appropriately. But quite honestly, that's what most medications do anyway, is that most medications are provided to a patient to then help control the symptoms and sometimes get at the root issue. But quite honestly, LDN does work at the root issue much more effectively than most other medications, because of how it works at the cellular level to control inflammation and also the immune response. And just like other medications, you remove LDN from the picture, all the benefits go away and they basically go back to kind of where they were. But what we found in the last, probably 5 to 10 years is that low-dose naltrexone can sometimes be taken twice a day. Now, Dr. Lannis and Dr. Forrester actually talked about using low-dose naltrexone for a wide variety of mental health issues. And again, there's a direct correlation as to what's going on in the gut and the inflammatory processes that then lead to changes in the brain. And they will sometimes use LDN up to 4 times a day. But again, this is under very controlled and supervised situations. And they're not using it for the intermittent use to decrease inflammation. They're using it very differently. But what we do know is that if LDN were to be chronically, constantly in the body, we don't see the same modulation of the endorphin receptors, the upregulation of the endorphin receptors. What we really need is kind of a pulse effect, or have LDN around for 4 to 6 hours and then have it go away, because that gives us enough time. The body actually responds in that it will block those endorphin receptors. Therefore, the body will make more receptors. LDN goes away, then you get a flood of endorphins and they fill those receptors. And that helps with pain control, helps with inflammation, helps to modulate the immune system, and people feel better. They feel calmer. Some people even find they have better energy. That's all dose dependent, and it's very individualized. So we have to be very careful about doing that. So the one question that comes up is, how quickly does this work? Well, some people find results with low dose naltrexone fairly quickly, but we do request 4 to 6 months to really find the full effect before you bail out on it. Some people find that they have symptoms that rear its ugly head early, especially if there's an underlying viral infection, which is whether that's diagnosed or not. They can have blooms or flares. Same thing with fungal overgrowth, like small intestinal fungal overgrowth. They can have blooms or flares, and that can cause the symptoms to elevate. And so what we want to do is then lower the dose of low dose naltrexone, not increase it, but lower it, and then use other supplements to then help control that situation. So the other question that comes up is, well, I don't want to start low dose naltrexone because I don't want to take something for the rest of my life. It's like, well, but you're okay taking a blood pressure medication, a cholesterol medication, and perhaps even a new medication for diabetes a little bit later. But you'll probably end up taking those all your life. So sometimes low dose naltrexone can actually replace some of the other medications that are chronically prescribed as well. And then there's other compounded medications that we use for a wide variety of other symptoms that are often associated with autoimmune disease, such as bladder control issues, muscle stiffness and pain, even sexual dysfunction, and also to help balance the hormone to help balance hormones. We use a wide variety of topical, sublingual, and sometimes even oral therapies. Now, what I find interesting is that with a dysbiosis, so a gut biome that's just not quite working well enough because maybe there's too many bad guys, they a lot of times those individuals may not make enough digestive enzymes. There's some pumps that are turned off, overexpressed, or just not doing well, or perhaps they're on medications that actually suppress the production of digestive enzymes. Now, what we know is that stress will have a huge impact on digestive enzymes. Sometimes it'll make them flow overly necessary, and sometimes it will suppress them. But we also know that digestive enzymes will reduce inflammation in the gut. It improves the nutrient assimilation from our foods. It helps to support the normal or the better balance of microbiome. It can also help reduce food sensitivities and allergies. And it's also helpful in reducing autoimmune response and improves tissues, skin tissues on the outside as well as on the inside. So really, what can you do right this second? Well, low-dose naltrexone is a prescription. So you can definitely talk to your provider about how to do that. And if they need help, if you need help with information to take to your providers, please let us know. We are more than happy to provide those. Vitamins, supplements, there's a wide variety of things that you can start with. I always start with the core 4. Living where we do, we're very deficient in vitamin D. I personally don't think that we have a flu and cold season. I think we have a vitamin D deficiency season. We do know that with vitamin D is optimal at 70 or above. We see less incidence of autoimmune symptoms. We also see less incidence of cancers. So keeping that blood level at 70 or above, but not too high, because there have been reported toxicities. We have to be careful with that. So again, it's about optimal, not being excessive. Same thing with using multiple vitamins. I love multivitamins. I don't think we get enough nutrients out of our food, but we also want to make sure that we're using really good omegas. And this is a very good one. There are others as well. And a B complex, because a lot of times when we're stressed, if we're inflamed, we're burning up those nutrients, specifically the B vitamins. Even in women, more specifically B6, we burn that up very quickly. And B vitamins are the key nutrients to help move metabolic processes further down the line. It's also key in so many other metabolic and movement type functions. What I did not list here is magnesium. Magnesium is mandatory in so many chemical reactions in our body. It's a natural muscle relaxant. It's very calming. It helps us sleep. And a lot of times we can help individuals with their symptoms by using over-the-counter professional grade vitamins. And also probiotics. We talk a lot about probiotics, but really, what is best? There's a lot out there. To me, I think it depends on whether or not you've been on a antibiotic in the last little bit, in the last few years. What we know is that broad spectrum antibiotics can actually decrease the gut biome diversity, and they can actually increase pro-inflammatory response. So in other words, you actually make chemicals that cause inflammation because you've wiped out the good guys as well as some of the bad guys. So spore technology probiotics tend to be taking off, and they survive digestion much better than a typical probiotic. But I also don't think that one probiotic is good for every person. And I don't think that it's necessarily the same probiotic that should be used all the time. When we test what is going on in the gut, we can then make a better selection for that. But the megaspore biotics tend to be a better option for a lot of people. You can also learn more about low-dose naltrexone on our website, the LDN Pharmacist. You can also see a wide variety of protocols there, including applications with veterinary. We do know that there's a lot of similarities between what we have as receptors in our bodies and animals do as well. So we can help our critters to have less inflammation as well. And if you ever have any questions about anything that we've talked about tonight, we've had virtual teachers for a very, very long time, not just in the last few years, but we're also very willing to help at any time. And this is how you can contact me. You can contact me at the store. You can call or text your questions or requests, and you can also email me directly at Michelle@makerspharmacy.com. So I want to thank you very much for coming tonight and listening in. You can also take a look at our 2023 seminar list that will be posted very soon on our website at makerscompounding.com and also on the LDN Pharmacist. So thank you very much for joining us. I don't see that there's any questions in the chat at this time. So I want to wish everyone a very happy Thanksgiving and bless you in every way. And thanks very much for joining. Take care. Good night, everyone.